Today marks 43 days since the imminent threat of the coronavirus was identified in the city of Wuhan in Hubei province, China. So far, 259 deaths and 12,000 cases have been confirmed worldwide. Scientists have found that 20% of the cases that lead to severe pneumonia and death occurs in people who have already pre-existing conditions.
Infections can cause pneumonia, a severe acute respiratory syndrome, kidney failure, even death. The people with existing chronic condition and have increased vulnerability to more severe cases, like people have the hypertension, diabetes, compromised immunity, and the current estimate of the disease incubation period, which is about 2 to 10 days, but we still need more time to estimate. With the evidence come out, we probably need more time to estimate detailed data available.
While there have not been any confirmed cases of the coronavirus in PNG, already 4,000 people have been screened. The country's biggest concern has been our seaports, where Asian logging vessels frequent and cruise ships come into dock. Earlier in the week, in Milne Bay Province, quarantine efforts were stepped up, with the provincial authorities seeking directions from the National Health Department when dealing with 2 cruise ships that visited Alatau.
From what I am gathering, the ports, if there are ships that are going to be taking logs and whatever out into some of our remote settings, they will have to, first port of call will be Port Moresby here. And then the whole process is activated here in terms of the quarantine or the screening or all of that before they get to where they are, going to. And so that would be how it's been advised or how it's been approached. But that is also, while that's the key gist of what we will be doing, it is also the responsibility of the Corps now to step up into the provincial settings in case, like as we go along and the need arises, then those that are trained right down at the ground level take on those responsibilities that they will have to execute. As an example, one of our provinces had 2 ships that were going in today, and their administrator had to ring and find out how we are approaching it. And we said, execute the laws, the quarantine rules within that setting, and get your local medical authorities to do that, and then clarify and check in the process according to the protocols to get the ship cleared.
But one of the country's most viable entry point, Jackson's International Airport, continued to remain in the spotlight, with the public constantly questioning what measures were being put in place to ensure that no passenger entering from Asian ports would bring in the coronavirus. The acting health secretary providing a reassurance that nearly all passengers arriving from Asian ports went through a stringent process at overseas ports before arriving in PNG.
Certificates so that they can be screened and allowed to come through that process. And also, yesterday in that conference, we alluded to the point that each one of those airlines where the passengers are coming from, they are also required to fill in the forms so that we can be able to clearly articulate who is a suspect or whom we should follow through and all of that. And that process is already there. Those processes are already there, and they're effective already. The key point is to stepping up and ensuring that we don't miss any of those particular flights.
Our national airline, Air Niugini, which services the 3 Asian ports of Singapore, Manila and Hong Kong, also put in place a requirement for a medical certificate before allowing passengers to board for PNG. Air Niugini also refusing to uplift any passengers coming out of Wuhan City. PNG Immigrations Authority also briefly suspended the online visa and visa on arrival on Tuesday. The suspension subsequently removed the next day based on a recommendation by World Health Organization.
They suggested that the evidence has shown the restriction of movement of people and goods during the public health emergency may be inefficient. may divert resources from intervention. Further, the restriction may interrupt the need to aid and technical support, and may disrupt the business, and may have a negative effect to the economy, the country affected by the emergency. So WHO not recommend any travel under restriction.
At present, passengers arriving through the Jackson's International Terminal are required to complete medical forms and screening by WHO stationed there.
You can read English.
Thank you.
Based on the Health Department's advice, the National Airport Corporation now requires all airport staff and airline staff to wear protective masks and gloves. This is in addition to the majority of passengers traveling in from Asia who are also wearing masks as precautionary measures.
Screening and what else we're doing at the airport. That's number one. Number two, all our virus settings, including the airports, all have been PP'd. All our staff and NUGINI and National Airports Corporation. That's the instructions that we gave them last week, and they are following it. We are working with them to make sure that we also support them with whatever requirements from us, including masks and all the other things that they require. For the ports, we met with them on Tuesday, and they've given instructions to all the airports. And if you see how the ports operates, it's under health and safety. They need to wear masks. So for them, I think things are working, and we'll follow up with them again next week.
With everything in place to prevent the virus entering PNG's border, the government was heavily criticized this week for seeming to lack communication of what was being done through various line agencies.
They did not add anything, any official statement been released by the Prime Minister to date. I have not heard anything. I don't know whether he's in the country or government silence is really deafening. It's really bad.
The Prime Minister finally speaking to media during a business breakfast, apologizing for not speaking to media, and then later outlining what his government has put in place after NEC met on Tuesday with NDOH and WHO.
Firstly, my apologies if response from respective agencies and ministries haven't come out clearer. But yesterday morning, our health department and our representatives from World Health Organization who are in country came to me, and we've agreed on the process forward, and I'm satisfied with what we discussed. We are sensitive to what is at play. International travels requires migration from different borders, so to speak. Borders that they originate in terms of traveling in, and borders as they enter into our country. And so we are in discussion with the different countries that we have inbound flight from, Singapore, Philippines, China, Japan, Australia. And in those countries, there are also higher standard of scrutiny and tests, because this epidemic is a global concern. It's not just something that is a matter between Papua New Guinea and China, or the Wahoo province, or whatever it was, so to speak. So we're mindful of this, and we, as of yesterday, in my discussions with them, we've agreed that at Jackson's Airport there will be a specific facility set up. Those flights that are coming in, medical officers will be stationed there with the immigration officers. Going to suspect cases will be dealt with there and then, including having a facility to address them and ensuring that they are monitored properly, if not sent back. And so as a heavy series of exchanges going on between us and nations who sharing borders to ensure that we scrutinize those who are traveling in from outside and also traveling from inside.
On Friday, the Prime Minister extended his condolences to those who lost loved ones to the coronavirus, but also reinforced immigration's statement that all nationalities wishing to travel to PNG from China are to get medical clearance before entering PNG. Countries including China, Australia, Britain and America are currently working around the clock to have a vaccine for the virus. With WHO declaring the coronavirus as a global emergency, it would now allow countries to test and manufacture the vaccine at a short timeline.